next speaker is another bridge builder and a treatment expert, Mark Parrino, again well known to a lot of us, is president of the American Association for the Treatment of Opioid Dependence, which represents more than 850 programs. I think he's very active in Mexico these days and is called upon really worldwide to be a voice for an expert voice on behalf of folks needing treatment for opioid dependence. Mark.
Thank you, John, and it's good to be with you. Thank you, Michael, for inviting me, and for your staff for putting on this magnificent event. I know what it takes, and you've certainly packed it full as much as possible, and I appreciate that too. And also, in reacting to what Dr. Clark said and the SAMHSA division, I'm reminded that Dr. Clark is a newly minted CSAT director, spoke at our conference after, I think, 1 month, 10 years ago. And I'm sure it's amazing how quickly 10 years pass. But I am grateful for the leadership and for the vision that Dr. Clark has shared with us, as has his predecessor who's here, Dave Mactus, and for Tim Condon as well, and Nora. You know, there is something about a partnership. This needs to be said before I give you some of my observations. I know what it's like to deal with unfriendly federal agency representatives and friendly ones. By the way, it's a lot easier dealing with the friendly ones. And that's kind of a first general observation. Also, you know, I'm very encouraged by this kind of recovery movement, because I think it provides very valuable and much needed fuel that will help us. There is nothing to be frightened about. There is no circle that needs to be defined to lock some other part of the circle out. It is, in fact, one part of the whole. And as long as we can embrace it honestly with integrity, we'll all do well. Absolutely no one loses in this at all. I'm also encouraged by the progress when Tom McClellan says to me that the Betty Ford Center has also embraced and listed medication-assisted treatment, methadone and buprenorphine, as patients being in recovery as they engage in the system of care. That is, to me, a very big deal, because I'm reminded, having done this for more than 25 years, that when I was reacting to Professional Counselor magazine some time ago in the mid-1980s that said something about, well, there's recovery, and there's those folks on methadone, maybe some of them are in recovery, but it's not really a good recovery or a pure recovery. And there's almost an animal farm version of some animals are treated more equally than other animals. It's very different, and that means very genuine progress has been made. And I think that's extremely helpful. So some observations. And you see in the SAMHSA paradigm that Dr. Clark eloquently presented that we really don't think that scientific evidence-based treatment and recovery-oriented systems of care are at polar opposites. That is perhaps a view in the past. It is not a view in the present. And that's certainly not a perspective that's going to get us where we need to be 10 and 20 years from now. So from our perspective, what were perceived as polar extremities have now collapsed inward and are now integrated. We also need, this is a point that's been made, but I don't think it can be made often enough. We must encourage treatment providers to embrace this and to encourage people to speak out. We must be supportive of recovery efforts, and the treatment providers really need to embrace this time and again. Because if that does not happen, we could create this concentric circle, but then have something on the outside. As Karen Carpenter-Blumos said, we create the environment of acceptance. And obviously, given what her remarks, you can see that she's a rather low-energy sort of person. And I have to say that we are grateful in New York State for having her, because she brings urgency to the issue. And I'm grateful for the fact that one of my associates, board members, and the chair of our conference in New York a year from now, Ira Marion, is co-chairing a task force in the paradigm that Karen talked about with Dr. Frank McCory. And we genuinely think this is going to lead to a major source of re-engineering, where we honestly evaluate where we are. And I think that's what we have to do as individuals, as members of a family, as a treatment group, as a system, as an association, as a community. If we're not honest with each other, then we are not going to make it. And because it breeds a kind of inherent sort of dishonesty, however you're going to call it. Also, I think that as we move forward, we plan, and Ira and I have talked about this too, is how do we embrace and bring forward this kind of theme that's been discussed here and make that part of our own national discussion. Because there is so much to focus on and embrace to bring a treatment system along and to encourage these voices. Dr. Clark's mentioned it. There is an incredible and painful reality that 20 million people are not seeking treatment. Melody's talked about the impact. We know where they are going. They're not going to the right place. I was in Washington for the past 2 days and had the opportunity to listen to an important presentation from one of our associates in France talking about what they had been doing in France. And there was an interesting public health model that was discussed, which is that when you have 50% of people who are active substance abusers getting access to treatment, you begin to see at that 50% level a significant change throughout the entire society about where those people go, which affects directly people going into the criminal justice system, people showing up in emergency rooms, people showing up in psychiatric facilities, people in the courts, people in the cemeteries. What happens is if we get to that benchmark, can you imagine what might happen if 5 million of those 20 million were accessing care? It's a big chunk, but imagine that. And there are countries in Europe that actually have achieved this, France being among them, as it turns out. They have actually hit that 50% benchmark. And as a result, they see the concomitant decreases and the impact socially that has been discussed. In Europe, by the way, there is medication-assisted treatment available in more jails and prisons than in the United States. So bridging that gap, our association has certainly spent time in trying to work with the criminal justice system, and I'll take the opportunity, it's great to run into Melody again, because we will have and forge a greater partnership, especially as we get to our conference in New York, and then as we get to our next conference in Chicago in 2010. The other observation, which is clear, and this is by no means innovative, but necessary, and it bars on what Dr. Clark talked about, is we really do need a massive, ongoing public education campaign that talks about these very issues. We need to convince still the culture in the United States that this is not some sort of foreign issue. We still know that when alcoholism and drug abuse becomes real to a family is when a family member is affected. And then it becomes real to us as a family member, as individuals, as our neighbors, as a community. So we really do need to find ways, and perhaps there are innovative ways, as I've talked to with Carol McDade and some others, about having some pharmaceutical industry representatives. Put some real money behind a public education campaign to help support that, and also with some public funds as well. But there needs to be a method of convincing the American public that there is a way to conquer this issue. Not be victim to it, but embrace it and actually do well with this. But also, I need to say, and this is going to be part of my concluding remarks, that part of what I would like to do, and I've been doing this for a long time, as some of my colleagues know in this room, and we've been working with Glenn Cooper as a former ATOG board member from Pennsylvania, that what we have tried to do is forge with a real sense of vision, a 5-year plan, which is loaded on our website, trying to achieve really useful objectives. We've adopted new training programs now. We've been training physicians. Dr. Chandra Taylor in the room has helped with that as the lead initiator of that. In private media training, using our conferences, prepare our field. That's what APUD tries to do, is prepare our field. We want also to focus on this issue of recovery-based movements and embrace that as well, because we think that would be helpful in getting into members of Congress. Not a few, but by the tens of thousands, because that influences how decisions are in fact made. But one of my real objectives, something I would like to do before I end my tenure at some point in the future as the ATOD president, is to have methadone-maintained patients be proud of the treatment they receive in the programs. It is painful to me, at a very deeply personal level, when I run into patient advocates who will say to me that they are not proud of being treated, that there are counselors or there are treatment providers that derogate them, that basically distance them, or where a patient advocate in one of the northeastern states says to patients who come to her, well, look, you just have to accept the fact that you may not get properly heard or respected at the program. This is a painful sort of thing. And I would be completely disingenuous if I did not acknowledge that that exists in different parts of the country. So, as the president of a board, and I know that Ira agrees with his perspective as the chairman of the conference that we're having in New York next year, this will also be a focus of how we get the treatment programs to work with patients in such a way that they're proud to be part of the treatment system, they're proud to advocate with their families on behalf of providing access to other people, and that's how I think we get from where we are to where we need to get to some time from now. So Michael, thank you again for the opportunity, and thank you again for being so kind.